Good morning, and thank you for joining us for this episode of SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton. Excited today to bring on one of our valued partners from Physicians Regional. We have Dr. Ann Rainville who's with us. Dr. Rainville, how are you this morning?
Oh, I'm very well, thank you. Very happy to be speaking with you.
Yes, ma'am. Thank you so much for taking the time out of your busy schedule. We appreciate it. So tell me a little bit about the woman behind the white coat, how you got into medicine, a little bit about yourself.
Sure. Well, I'm originally from Maine. That's where I grew up. And from a very early age, for some unknown reason, I was just fascinated with anything that had to do with the workings of the human body and medicine, and decided that I wanted to be a doctor. That was my plan, and I did achieve that. But it wasn't until I was in medical school and I did my OBGYN rotation that I realized that that was really what I was meant to do. I love taking care of women in all aspects of their life, and I delivered many babies.
Oh, good.
I'm still very excited and happy to help women be as healthy as they can be.
Yes, ma'am. And we are entering, what is it? Ovarian Cancer Awareness Month, I believe it is. It's month of September. So what is an ovarian cyst, and why should we worry about them as females?
Sure. Well, ovarian cysts, it's a very broad term, and there are many things that can qualify as an ovarian cyst. In a very simple, the simplest type of ovarian cyst is actually quite normal. And in the ovary, in the normal process of doing its job, which is to produce an egg to eventually that might become fertilized and become a baby. In that process of an egg being formed, the ovary does make a small cyst. And that's normal. So if a woman goes in for some sort of imaging study and they find a small, what we call simple ovarian cyst, those are very common, and they're not of concern. However, other types of ovarian cysts can be a little bit more concerning. So ovarian cysts that are of a larger size, usually over 3 to 4 centimeters, which is about the size of a walnut, just to give people an idea of how big that is. Ovarian cysts that are larger than that, if they are not really what we call simple, or look like a little balloon filled with just fluid, if there's some complex or some other sort of things that might be in that cyst, that can be a little bit more concerning. So the way it looks is what kind of decides how concerned to be about them.
And so how can you really tell if one is cancerous? Obviously if it's the size of the walnut, but right. Is there any other signs and symptoms of like how you diagnose that?
Absolutely. So the first thing that's most important in terms of knowing whether an ovarian cyst may be something dangerous is, like I was alluding to a little bit before, is just how it looks on the ultrasound. So ultrasound is the best way, and specifically an internal ultrasound is the best way to be able to evaluate what an ovarian cyst looks like. So the way it looks on the film is very important in determining whether it's something to be concerned about. The other, size is of some interest, but not the most important. It is actually the way it looks. The other thing that they can look at with ultrasound is whether there's abnormal blood flow to that cyst. And the last thing that can be helpful to us is there are certain blood tests that can be helpful in kind of evaluating whether something may be a potential malignancy or an ovarian cancer. And the specific blood test that is used most often is something called a CA-125. That's a very routine blood test that's easily obtained.
Now, it's as people age, it's important to continue getting their pap smears. Like, how is someone screened for this other than the internal ultrasound, or is that really the best way between the blood test and the internal ultrasound? And how often should they be screened?
Well, the problem with ovarian cancer, unfortunately, is that we really don't have any firm evidence that there's any specific screening protocol that is effective. There really is nothing that that we know of. There have been many studies that have looking at blood tests routinely, screening by that CA-125. That doesn't work because it's not accurate enough in terms of false positives and false negatives. So it can't really be used as a general screen. It's only used for specific instances. Ultrasound is very helpful, but there are a lot of false positives. Women have cysts all the time, and there's really no specific ultrasound finding that is a precursor to ovarian cancer. So that's the problem, is that that's how screening protocols work best, is that if you can find something that you can identify as a precancerous condition, then that's where it really can make a difference. And at this point, we're just not there. On the other hand, medicine is always changing. And, for someone who's, basically my life is involved in making sure that I know the most up-to-date things in terms of women's healthcare, and in specifically things like ovarian cancer screening and other types of cancer screening. And so going to see a gynecologist every year is very important, to be able to discuss with your physician what you're feeling. Some symptoms of ovarian cancer are very different from what women might think. Usually ovarian cancer does not show up with pelvic pain or with abnormal bleeding. It shows up with unusual abdominal symptoms. So again, it's important to kind of touch base with your provider who is specifically interested in pelvic problems and ovarian problems, to try to help the woman to feel that, that she doesn't have any symptoms that are concerning, and also to make sure that there may be something that's new that she's not aware of, that she can take advantage of.
So I think the takeaway here is that your traditional symptoms may not be what you think they are at all. And if you shouldn't ignore those signs, because obviously the sooner you catch something like this, the better.
That is absolutely true. And, I tell all of my patients that, if they have any unusual abdominal symptoms that persist for more than 2 weeks, that as well as calling their primary care doctor to evaluate they should also call me, because the first thing I'm going to do is think about getting an ultrasound.
Absolutely.
Because that's my focus. And so that's where it's I think helpful for a woman to have a gynecologist who is on her side, to make sure that that is being evaluated first, or
so important.
Close to first. Yeah.
So important.
Yeah.
So annual exams and not ignoring signs or symptoms that you think may be something else is incredibly important.
Exactly. Yeah.
All right, Dr. Rainville, thank you so much for your time this morning. It was a pleasure getting to know you. And if anyone wants to get a hold of Dr. Rainville, her information's in the chat.